Thank you, Professor Manuel as the moderator, and also Dr. Dababrata Chowdhury as the rapporteur. So our Honorable Professor Alam Ahmed, Janet, and also all distinguished participants of WASD Conference 2024 from across the global. So ladies and gentlemen, it is with great pleasure and honor to meet with all of you on this important event, and allow me to present a topic on catalyzing the global collaboration, strengthening multi-helix network in community development to accelerate the achievement of the Sustainable Development Goals or SDGs with the WUACD and also Universitas Airlangga as the best practices. So, distinguished participant, before we begin, allow me to introduce the Universitas Airlangga. Cannot move. Excuse me. Cannot move the. Yeah, cannot also. I'm sorry, this slide cannot move. Yes. Okay. Yeah. Okay, thank you. So Universitas Airlangga, we are also very supporting of the SDGs. So we have the policy of our president of Universitas Airlangga. Also, he's the president of WACD for the Sustainable Development Goals on acronymized with the SMRRNT. So the S is sustainable education for all, and the important thing of the M and A is the meaningful research and community services or community development. This is strengthening the meaning of research and community services or development in supporting the achievement of the SDGs. So through three pillars, we aim to address the complex challenges of today and also for the tomorrow, driving progress we are doing by education, research, and community engagement approaching using the multidisciplinary aspect. So, ladies and gentlemen, we know all of us about the 17 goals of sustainable development set by the United Nations. And we know that from the learning from the COVID-19 pandemic, we know now that the climate change of the number 13 of the SDGs is very interconnection, close with the impact of the good health and the well-being. So learning from the COVID-19, we know that the climate change also changing and emerging and also re-emerging the infection disease. So we're learning about the COVID. We know that this virus of the COVID-19 is appear in 2020. And then after that, we face all of us in the global pandemic in the earlier of 2020. So it's been 20 years after that, everything then changes, and learning from that. So it's mean that the environmental is becoming more important for all of us, for the living organism and also the abiotic or non-living organism. So it's mean that this impact to our human health is not only the health of the human, but also the other living organism. So for that, our university also very deeply pay attention how we can then achieving the SDGs for the global environmental health. So the important thing on food and also health and environmental for security and also food, health and environmental resiliency. So both of these, of course, will be our important focusing on global environmental health. So it's mean the health for all living organisms and also our environment, of course, surrounding in our earth. So in Indonesia, we know that Indonesia is archipelago country. So we have the concept of the communities development is self-empowerment. So we do together with our society, it's not by 2 or 4, but we do together with society and the by society. So we are also concerning in the SDGs in desa, or we mean desa is village. So the SDGs village is ushering the rural Indonesian towards the global development goals. So because Indonesia is the archipelago, we have around 17,000 islands. So it means we have the area of remote island that we difficult to reach this kind of the island, and also they need very characteristic or unique culture, like near of our East Java province, where Universitas Airlangga located in east of the Java in Surabaya. So near of East Java, we have Madura Island. The Madura Island have more than 14 remote island nearby. So this one is becoming our pilot project for the SDGs village. So maintaining their environment and also empowering their society in the health and also in environmental health in this area. So the other pilot project is on border island, because Indonesia also surrounding with other countries in Asian and Australian and also others. So we are also focusing on border island, where the Indonesian migrant worker also come to a nearby of this island, like in with Malaysia, Singapore, and also another country. And the other pilot project is the coastal area. We have also other campus in Banyuwangi. So this coastal area, we focusing on the developing the green economy for the circular economy for the SDGs in number 15. So the SDGs desa or village, we have the program together with the government from Indonesian government and also the East Java province. We also helping our society. We call it Desa Emas. So emas, it's mean in English, it's mean gold. So I think gold is very valuable material, right? So emas, this is meaning eliminating the society with the stunting, because we Indonesia still have also the problem with the stunting. Actually, for our next generation, so this is will be very important to reducing the stunting in east of Java. So for do this with the society, we do with the 28 district and also inter-university collaboration among East Java province university. So from this Desa Emas, as the part of the SDGs village, we also involve the student for emancipated learning, like mentioning by Professor Beverly, she talking about that the student only study in campus is very short time, so see their need also learn with the society. So for this kind of the stunting, we also got the award from our government that we call it Wirya Karya Kencana Award, just awarded last month to our university as a for the lead of this kind of the program. So another program for the SDGs village to maintaining our young mothers and also the children. We call it Gilead Airlangga. So Airlangga is the name of our university, and Gilead, it's mean this program is under collaboration with the UNICEF. So this program also have 4 program. So elevating the capacity building, empowering community policy, and also the system of health through education, research, and community development. So the chairperson of this is come from the Faculty of the Public Health, but we do this program with the society under the multidisciplinary approach and aspect. So the program is, there are 3 priority program. The one is health cluster for mother and the children. And then the other one is health cluster for immunization. And then the last one is WAS cluster. So WAS, it's mean water, sanitation, and hygiene. This is the program of the Gilead. So the important thing that we aims to reduce the maternal and infant mortality rates and ensuring that mothers and children receive the care that they need. Due to the Indonesia that I'm mentioning, we are archipelago country, so how to reach the remote island? We have with our alumni, we have the floating hospital. They will reach the remote area and also approaching the society that have a very specific culture to them. So we do also in this program. So I have the video, very short video.
Indonesia is a vast country. The population has reached 264 billion, spread across 17,504 islands. They have every right to get health insurance. Universitas Airlangga Hospital, Olivia, and East Java Health Agency fill the colony. To give people living in other islands access to healthcare services, to provide immediate assistance to disaster areas through the floating hospital, even to support humanitarian needs. Across the ocean, reaching the outermost islands, the medical team of Chowdhury Airlangga Floating Hospital is always there to serve humanity.
Here, I'm sorry. I don't know because it's already in this moderator, so I think it's okay for all of you. I'm really sorry because the sound is cannot appear in this room. So for the Madura, the remote island, we choose not all of the island because we have around 14 remote island at nearby in East Java, so very near with our campus also. So we visit and we reach this area. We choose 4 island. So the Gili Iang, Putaran, Sapudi, and Raas Island. So we invite all of you to join this program. Maybe in the future, we do together to visit the society and do more in like the environment approach, because in Gili Iang Island, this island is very unique. This island contain I think the 2 highest oxygen content in the world. That is the important thing of this island. So it's mean we should maintaining the oxygen content in this island. So we introduce the electrical vehicle and also solar energy in this island. And also we are the natural resources that very rich in the marine area, and also the fisheries near there in this island. So we are encouraging and empowering the society people to educate them how to manage and also exploring and conserve this kind of the natural resources from the marine, and also how to maintaining the oxygen in their island. Of course, they also have like a herbal medicine. So we introduce also how to planted the plantation of the herbal plant that give them more benefit from the society, like for the small and medium enterprises. So this is what we do together with the society to like developing the solar energy to implement it, the airfield and also air quality in this remote island of Gili Iang. So the other thing that we do together also already mentioning by Janet in this morning, and also Professor Alam, that the partnership in connection, engagement with other university, not only in local, national, but also international engagement will be very important. So because we are Indonesia, it's part of the ASEAN countries, so we also engage with the ASEAN Biocircular Green Network with Universitas Airlangga. So for the transforming waste into the wealth or circular economy approach. Okay. So this is mostly the circular economy that we develop together in the scheme of the ASEAN BCG network. So we have teaching industry in our campus and also in coastal area of Banyuwangi. So this is more to convert it the waste to becoming more valuable material. So from this, of course, we would like also to engage not only in local but with the international partners. So our president then established the WACD that mentioning by Prof. Alam, World University Association for Community Development. And now we have around 37 partner. And also we do together the community development, not only in Indonesia, but with the partner of members country, university country. So this is what we do together in East Timor, in Thailand, in Malaysia, and also in the East Timor, yeah, Timor-Leste, sorry. Okay, so the last my slide. So this I think the community engagement is very important among us, among the country. Like we do as a biochemist, we know that enzyme is the biocatalyst to synthesize from the very small molecule to becoming a macromolecule. So it's mean this association can be also built step by step to expand our partnership to the goals of number 17. So we can do this like by multi-helix. So from our experience in the COVID-19 vaccine development, so with the WACD, we can then expand our engagement for the community development program with the WASD, with the multi-helix, with the Asia Engage of AUN USRNS. This is University Social Responsibility, and also ASEAN BCG or Biocircular Green Economy Network, and also all of you. So thank you very much because the time is up. Thank you for listening us. Thank you.